feels occupational, is it important or not?
It's very important.
So again, so you ask, and at the last address, sometimes maybe you need his address if he will be in severe conditions. You need his address. Next examinations, you will start with, you will continue with complaints.
What are the complaints of the patient?
Next, after complaints, anamnesis or history. For example, if you want to know about some ototoxic drugs he used or not, you cannot ask, have you used ototoxic drugs? He doesn't know what is ototoxic. Exact questions you should ask. Gentamicin you used or not? Aspirin, epistaxis, bleeding from nose, you used or not? Exact drugs you should ask about it. Потому что maybe he will forget to tell, to inform about it. Next questions of history, exact general diseases you should ask. Это что? Hypertension, diabetes. Потому что these diseases may cause some ENT pathologies also.
Pregnancy, female.
Да, pregnancy, так далее.
Pregnant.
After finishing the questions, only then you will start your examinations. Examinations of patients will start with the face. If present some diseases of the ear, if present some diseases of the nose or paranasal sinuses, you can see it on the face. For example, which diseases of ear you can see like pathology on the face? Facial nerve paralysis.
Facial nerve paralysis.
Facial nerve paralysis present in which diseases of the ear? Chronic otitis mass, or maybe he made operations in the middle ear where surgeon stopped, he cut this ear. If present disease of the nose and paranasal sinuses, you can see swelling edema of any part where located the sinuses. Swelling of upper lips, some of lower lips, of cheek, of forehead, etc. Furuncle if present the hyperemia of the nose, hyperemia or edema of the upper lips. It's all symptoms of diseases of ENT organs. So with face, you always start your examination. Then otoscopy pictures. You see the gland located on the right side of the patient, opposite the examiner. So we need in these reflections we need in this head mirror for the reflections. You turn his head, if you do it, and you push spin how you know about it, upward and backward. And by this stump, you can help yourself with opening the apparatus. And now, if your technique is correct, even without speculum, all external auditory canal and even tympanic membrane visible.
Yes, ma'am.
What? If external acoustic canal is narrow, in this case we can use the speculum instrument. Again, you push pin the upward backside and you insert the spinner forward. And you can see tympanic membrane. Now without speculum, please try tell me which anatomy of external auditory canal just now you see. Cone of light visible or not? Handle of malleus visible or not? Tell me please. He has this or not? He has any disease of external or not? Please tell me just now. Before I forgot. Before starting otoscopy, you should start examinations of pinna. Form, micro, size, then present hyperemia or not. For example, if present hyperemia swelling here, maybe hematoma, maybe abscess, maybe perichondritis of the pinna. Keloid present or not. Then you palpate surrounding the pinna. If he is having severe pain, but his ear is normal, here you palpate the temporomandibular joint and ask patient open and close his mouth. During this movement, if he is having severe pain of this joint, your diagnosis, trauma or inflammations of this joint, while in clinical features he has only earache. Next, if you see that present here hyperemia, swelling and painful during percussions of this zone, your diagnosis is mastoiditis. Inferior the topography anatomy, you remember which gland present?
Parotid
gland. Superior the
temporal ये bone होती है ना.
So at first palpations, percussions of the zone, you see maybe any scars, maybe he had operations on the middle ear, and the hair will be scars. note. And then you will continue with otoscopy.
Yes, ma'am.
Okay, ma'am. Yes, ma'am.
Now sit down.
जा मुझे check